Hi, my name is JJVanZylOptometrists, and today we are going to talk about diabetes, and specifically and using an analogy of an airplane, how you can actually decrease your risk of going blind. And did you know that if you are a poorly controlled diabetic, you have a 25 times greater risk of going blind? Put in a different way, that's 2,500% greater chance of going blind, and that's not according to me, that's according to the CDC, the Centers of Disease Control in the United States. But let's leave the bad news for a while. We're going to try and focus today on what practical steps can you do, practical and low-cost steps can you do to minimize your risk of going blind. Because let's face it, who wants to grow older knowing that they're going to most possibly go blind? Right, and today we are talking about specifically type 2 diabetes. And my explanation to my patients, I use an aeroplane to explain why it is important to look after yourself as a diabetic. And it's an easy to understand explanation, but we're going to now introduce you to our diabetic aeroplane. So, of course, just a little bit of reality, and we're all doing a risk assessment every day. It doesn't matter in which part of the world you live, we are all looking at to reduce our risks on a daily basis. But did you know that as a type 2 diabetic, maybe that's poorly controlled, you have a 25 times greater chance of going blind? Now, recently we saw all the doctors in our area, more than 80 of them, and there was only one or two that really understood the risk of going blind as a diabetic. And this is what we want to talk about today, is how to reduce that risk. Because, put in another way, you have a 2,500% chance, greater chance of going blind than a regular normal person that's pretty healthy and that looks after himself and that hasn't got diabetes. So we want to reduce that risk. Now, why am I using an aeroplane? To try and make it easier for you to understand, because we all know that aeroplanes are not safe environments. And certainly you don't want to go fly with an airline that you know has got dodgy pilots, or the cabin staff isn't well trained. And of course the worst is if you have unruly passengers. So as a diabetic, you want to try and reduce your risk. And you are now talking to somebody that's now already been a pre-diabetic. And I started my year off with a retinal detachment. And I simply suspect that the reason for my retinal detachment was simply because of my childhood myopia and of course my elevated blood sugar levels as being a pre-diabetic. So yes, going blind suddenly certainly changed me dramatically and made me much more aware of the risks that you face as you grow older of going blind. And certainly it's not something that you want to go there. It is actually terrifying waking up and not seeing at all. But yes, let's return to our diabetic aeroplane. So as we all know, an airplane is not a safe environment. So what can we do, and what do the airlines do? What do they do to try and take that really unsafe object and make it ultra safe? The first thing is you want to have a well-trained pilot, co-pilot and cabin staff. Now, who are these people in your life? Your pilot is your ophthalmologist or your general practitioner or your MD, your doctor. That is your pilot. That is the person where you go and do your blood work, you talk to that person, you make sure that that person is an important, well-trained person in your life that gives you the right advice and gives it to you timelessly. So yes, making sure that the pilot in your diabetic airplane is well-trained is certainly priority, because in your case as a diabetic, your pilot is your doctor, and as I said, he will be looking after you. Who is your co-pilot? Your co-pilot is actually your optometrist. And why is your optometrist such an important person in your life? Because very often, one of the first things that you notice as a diabetic is unstable vision. Some days you don't see as well as other days. It can be fluctuating in your day. And of course, vision loss is one of the things which can dramatically influence your quality of life. And it's also one of the earliest things that we can pick up. And especially today with fundus photography, you can go for a yearly checkup at your optometrist, and they can take some pictures of your retina, and the AI can actually give you a risk assessment of what's happened the past year. So your optometrist is your co-pilot. That is the person that you have to make sure your optometrist, that you know him well. As a diabetic, it's a very, very important person in your life. And of course, your cabin staff in your aeroplane. Your cabin staff, as a diabetic, who's those people in your life? Those people are the nurses, maybe if you're on an old age home. Those people, the cabin staff, I equate to your rural clinics. The people that's maybe not your optometrist, the people that's maybe not your doctor, but that's also well trained. They need to be well trained. Those people need to be well trained so that they can understand what's going on with you and give you the right information as a diabetic. Now, at the end of the day, it is important to also make sure that your association with your passengers, in your case, it's your fellow diabetics, you have the right association with your fellow diabetics. Because in an aeroplane, if you have unruly passengers, you might even then have a crash. You might have a fatal problem then due to the passengers not being well controlled, or alternatively, not knowledgeable. So as a diabetic, I always tell my patients, make sure that you try and associate with other diabetics that's knowledgeable, that tries to look after themselves, that understands their condition. And of course, it's your cabin staff, it's those nurses, maybe the clinics that's going to give you the right information, that's going to educate you, that's going to be dealing with you on a daily basis. So make sure that you have this triangle, the pilots, the co-pilot, your staff, your nurses, and of course your fellow diabetics. Make sure that you get people that assist you, that's knowledgeable, that knows what's going on with diabetics, and make sure that you also try and associate with fellow diabetics that is positive, that understands their condition, because knowledge is key to understanding your condition and to lowering your risk of going blind. Now, as I mentioned here, beware of those unruly passengers. Beware of those unruly diabetics that just says, listen, don't worry, no problem. It's not the case. Always remember where you are. You are in an aeroplane. It's called the diabetic aeroplane, and it's not a safe environment. So as a diabetic, you are in this environment. You have this condition called diabetes, and we know that you have a much higher risk of going blind. But the similar things which the airlines did to control that environment, you must take those lessons and actually place it in yourself. You must become knowledgeable. You must make sure that your team that supports you is the best possible team. And they need to be well trained and need to follow the rules. Like you would actually give passengers in the airline, the passengers, like you would give them a chart or an explanation. Every time you fly, you know that there's somebody explaining to you the rules. This is how you actually behave in a plane. And this is what you want to be doing as a diabetic. This is how you should be looking after yourself. This is actually how you should be following the rules as a diabetic. Now, many people unfortunately don't even know that they are a diabetic. So again, just be aware that one of the things that is often noticed is that you got this dry mouth. One of the first signs. You want to go to the toilet often. You might be standing up at night. So if you are not a diabetic, and I tell my patients is that most of us know what we were weighing when we were 18 years old. And this is, again, according to me. If you are more than 25 kilograms heavier, did you hear that? So you know what you weighed when you were 18. If you are more than 25 or 30 kilograms heavier now than what you were on age 18, you are most possibly already at risk of becoming a diabetic. So forget body mass index and all that funny stuff. Just, you know what you weighed, go to the scale, you know what you most possibly weigh now. If you are more than 25 or 30 kilograms heavier than what you were at 18, then you might be a pre-diabetic or already a diabetic. So what we always start with our patients is that even if you're not classified as a diabetic, you might be at risk. You might be not aware of the fact that things are just slowly creeping up on you and that you might have become a diabetic without you knowing it. So the first thing we want to know is we want to know, are you diabetic or not? And I tell my patients it's like, buying a ticket. If you go traveling, they're going to ask you these questions. Are you ill before the time? You've got to fill in these forms sometimes. So make sure that you go and check. And one of the things that you need to know is looking at your weight. Now, let's now talk about what can you actually do. And I'm not going to talk about all the normal stuff. I'm going to talk about what I did. What I did to reduce my risk of going blind. What I did to reduce my weight. What I did to reduce my glucose levels. So the first thing you want to be doing is follow a healthy eating plan or diet. Now, we all know what a healthy eating plan is. It's not always possible to follow it. And even today, certainly I'm a little bit of a chocoholic, but you need to have at least one meal a day that's lots of color in your plate. So if there's something you want to be doing is add color to your plate for one meal a day. If you can, reduce that carbs. You know this, most diabetics know this, but try and follow a healthy eating plan. And what I found is that as I became a pre-diabetic, I was hungry all the time. I was eating, but I never really felt that I'm satisfied. So, and that is also a surefire sign that you might be edging towards this pre-diabetic stage. So how do you change that? You want to follow an eating plan that's healthy. You want to increase your protein levels. So have eggs. It's normally the cheapest meal, the best meal in general for the lowest cost. So have at least 3 eggs a day. Eat eggs every day. If you're hungry, eat an egg. That is the best way to control your glucose levels, which I found. And of course, try intermittent fasting. It's not something that I was considering doing. I actually fell into intermittent fasting because, well, it's a long story, but after COVID, my wife was a little bit late with breakfast, and one day we had a small disagreement, and I ended up not having breakfast the next day. So consider intermittent fasting, and there's lots of scientific proof today that intermittent fasting works. So what I tell my patients is that, when you wake up in the morning, if you're a little hungry, drink water. Drink more water. Drink water. Sometimes hunger is just, your body doesn't know what's going on. Just drink some water first. It worked very well for me. Right, now, what is do HIIT? Now, the HIIT stands for High Intensity Interval Training. So basically, get your butt off the couch and do some exercise. Now what I did is that I actually went and got one of these standing bicycles. And why is this so important? Because if you do 1 minute, that's 1 minute, 3 times a week, you get your heart rate up to just about your age maximum. Science has shown, and all the studies have shown, that an average diabetic can actually lower their glucose levels by up to 20%, but also reduce the peaks and the troughs. So it'll stabilize your blood glucose levels. Now, what does this mean in practice? It means that you're going to have more energy. You're going to be feeling less hungry. Please, as I said, drink more water. And it took me a couple of months before I could actually get to that 1 minute. So in the beginning, I couldn't actually cycle for 2 minutes on the bicycle before I was huffing and puffing like a steam engine. So yes, you want to get your heart rate up to approximately your age limit, and that's like 220 minus your age. And if you're like 60, it means that you want to try and aim for about 160. Now, if you've got a smartwatch, it's pretty easy to track your heart rate. But this is what you want to be doing. You want to do any type of exercise where you can get your heart rate up for at least 1 minute, 3 times a week. That's not really a lot. So it can be brisk walking, walking up a hill. It can be doing some stairs. And if you are overweight, I always tell my patients, try and do swimming. But make sure that there's somebody there when you are swimming, because sometimes you can feel a little bit like your glucose levels can dip suddenly. So be aware of that. But yes, this is something that I tell my patients, all diabetics must try and do some exercise. And if you can't sleep, which most of us struggle with as you grow older, I've tried everything from going to bed later to doing this to doing that. Eventually I just decided, I'm going to give up. I'm not going to fight this. If I can't sleep, I'm going to bed earlier. If I can't sleep, I wake up at 3 or 4 o'clock in the morning. I climb on my standing bicycle, on my stationary bicycle, and I cycle for 30 minutes, have a nice shower, and then climb back into bed. So if you can't sleep, do something. Don't just lie in bed. Do something, get yourself moving a little bit. Of course, all the basics still apply. What's the basics? Take your medication as directed by your pilot, your doctor. So make sure that you take your medications. You want to know what's going on with your body. Check your blood glucose levels. If you can have a continuous blood glucose monitor, that's the in-skin ones, the newest ones, that's fantastic. Otherwise, make sure that you just prick your finger daily, and in the beginning, maybe even more than once a day, and double check your blood glucose levels. Make sure that you are a knowledgeable diabetic, because knowledge is key, and knowledge is going to save your vision and most possibly your legs and your life. Now, check your feet. Very, very important. Check your feet. And now, if your ankles and your feet is maybe swelling a little bit, just take some Vicks and just put some Vicks on that hot area or the swollen area. You're going to find it's going to cool down and the Vicks is going to evaporate. So just take some Vicks. Don't rub anything that's hot. If anything is hot, especially your ankles, make sure that you lie in your bed, put some pillows underneath, maybe a little small towel, and put some Vicks on your ankles. Check your feet for any cuts and blisters. It's very, very important because there's a lot of pressure there. You want to cool down your feet and just, take some Vicks. If your skin isn't broken, take some Vicks. Put the Vicks on, even if it's nice and thick. Make sure that you put the Vicks on without rubbing it, just on that area that's swollen to cool that area down. That's going to restore the blood flow. It's going to cool the area down, and you might even find that you have less pain or foot awareness, I call it. Beware of condiments. So if you open your fridge and there's like 5 bottles of stuff in your fridge that's not food, just bin it, throw it away, and always remember that as you grow older, it's not just your eyes that's seeing worse or your hearing that's seeing worse. It's most possibly your taste as well. And I didn't use salt for many years, and then my wife said to me one day, "Lovey, why are you using such a lot of salt?" And about a month later I told her it's because I'm not tasting my food, and she looked at me weirdly. And then I realized, you think about your eyes and your ears, but you don't realize it's 10 to 1 your taste that's also going. So beware of excessive salt. Rather use some cayenne pepper. So I switched over to cayenne pepper, and I've tried to reduce my condiments as much as possible because there's lots of hidden sugars and stuff in those condiments. So be very aware of what is in your fridge. And talking about fridges, if you can, get a fridge that has got a water dispenser in. And why would I say that? And we want to eliminate, and the word is eliminate, fruit juices and soft drinks. Because fruit juices and soft drinks is similar to condiments. You don't actually know what's in these things. So you want to be drinking water. Water. 8, 9 glasses of water every day. Make sure you drink enough water. And why did I say fridges? Because at one other stage my fridge broke, and I replaced my new fridge with a fridge that's got a water dispenser. Now, if you're in a warm area, and I used to drink lots of ginger ale and Coca-Cola, if you're on a warm area, you tend to open up your fridge, and if you do it 4 or 5 or 10 times a day, eventually things become a little bit not so cold inside. And suddenly I found that when we actually swapped the fridge, when I replaced my fridge, I would just drink water from the outside water dispenser, and of course the stuff inside was colder now, but I didn't open the fridge as often. And simply by not opening the fridge and looking at these things that normally talk to me, I actually found myself having less and less fruit juices and soft drinks. So eventually I stopped drinking them because I would just drink cold water rather. So if you can, if you have a fridge that's got a water dispenser, this is what happened to me. But today I don't put my lips to fruit juices and soft drinks. I don't drink any soft drinks or no cool drinks, nothing like that, no fruit juices. And yes, please don't smoke. It's not just expensive, but it's really not good for your vision and your body as well. So this is things that you want to eliminate. You want to eliminate from your diet totally fruit juices and soft drinks. You don't want to be smoking. And alcohol, well, I drink some red wine, but you want to limit that as well. So nothing stronger than maybe a glass of red wine, and only then maybe 1 or 2 a week. And be sure that you have something before you drink your alcohol. This is very, very important. Don't drink your alcohol on an empty tummy. That's not good for you at all. If you do want to have some alcohol, or you are forced to have some alcohol, then you want to drink your wine after you've had something small to eat. Make sure that you drink your alcohol after a small little meal, and then you drink your wine or whatever, and then you have your main meal. So don't drink your wine on an empty stomach. And let's go back to what I just said previously. So remember, if your feet and ankles swell, you want to be using some Vicks as a paste or a poultice. Floss your teeth. This is a tip which my dentist gave to me. So be aware that it's not just your eyes, it's also your teeth very often that gets compromised as a diabetic. So floss your teeth, brush your teeth, control your blood pressure. Now, if you are using excessive salt, consider taking potassium as an additional supplement. Potassium will naturally lower your blood pressure as well. Again, speak to your pilot or your doctor, your MD. He can check your potassium for you, check your potassium levels before you start using excessive amounts of potassium, because it can be dangerous as well, like anything else. Very, very important as a diabetic. I've found that reducing and manage my stress levels is key to me feeling better. Reducing and managing stress levels is really, really important. And if you are still working or you have a stressful job, then do yourself a favor, just write it down, get a diary app on your phone, write down what's going on to you, get that stress out. And if there's one thing which I learned again, is that, if you're stressing about something, take a moment and ask yourself this one single question. Am I going to remember this 1 year from now? Sounds a really stupid question, but this really played and still plays an important part in my life. So if I'm stressed, I always ask myself, am I going to remember this stressful incident, which I'm now perceiving as stress? Am I going to remember this 1 year from now? And a lot of the time, I stand still, I'm going, I don't think so. So, why am I stressing so much? And of course, this is normally after I've actually taken some time to just make a note of what's going on, get that stress out. So try to control your stress levels as good as possible. And if the one thing which I found personally that also assists this is actually doing exercise. Doing that HIIT, that high intensity interval training, 1 minute, 3 times a week, that really helped a lot, because at one other stage I would climb on that bicycle, I would fight with it, and I would get my stress levels down, I would get my stress out. Now, sleeping. As I said, I'm a poor sleeper, but I've learned now that, you can't fight it. Good quality sleep. It doesn't mean that you have to sleep for 8 hours continuously. You can wake up 3-4 hours and then do something and then go back to sleep. And that's normally when I now have my best sleep, is the last 2 hours or so in the mornings. If you're a bit stressed as well, try some meditation. Try and find some peace in your brain. We have such a busy life today, and all of these things has an effect on you. All this noise, this social media. Take a time just to do nothing. Just literally, sit there, try and sit there and do nothing for 5 minutes. Most of us is going to find that's going to be pretty difficult actually. So reduce that TV and social media browsing time. Try and spend some time with yourself and your loved ones. Again, this is something which just happened naturally to me. So I must have lost about 20-25 kilograms already. And it's just because I was a little bit more knowledgeable. So I became a knowledgeable passenger in my own diabetic airplane. And what is our objective today? Our objective is actually, if we can, is actually to cure you. We want you to be that patient, that passenger that actually knows how to use a parachute, open the door, and literally climb out of that diabetic airplane and land safely. You don't want to climb out that airplane with no parachute. You don't want to climb out of that airplane with a parachute that you don't know how to handle. We want you to become a passenger or a diabetic patient that actually now doesn't have diabetes anymore. And that's possible. That is possible. But it's only possible if you start with what I've just told you. And you'll have your own rhythm. I was fortunate enough that some things happened to me naturally, but as I said, going blind overnight certainly changed my total approach on retinal detachments, on myopia control, and especially when it came to my pre-diabetics and my diabetic patients. So we are much more aware of the risks of going blind today. And do yourself a favor as well. The first thing you want to be doing, except about thinking, you know, what did I weigh when I was 18 and what I'm weighing now, is to go and have a look at my video about the pinhole lens, the selfie eye test. I call it, do you need glasses or do you need a hospital? So do yourself a favor, double check your eyes. Make sure that you can see with both your eyes. When last did you see your optometrist? Because your optometrist is the co-pilot. He's a very, very important person in managing your vision and your health, because he can pick up things very often, the earliest of everybody actually. And I've just used a top of a shaving cream holder, made a little hole in, and if you can see clearer through the hole, you most likely have a prescription problem, a refractive problem. You need some glasses. If you have a vision problem and you cannot see clearer through the hole, you might have a medical eye problem. So you need to go and see your doctor, your optometrist, or your ophthalmologist.